So it may or may not surprise you that somewhere around 27% of Americans who see their family doctor either drink too much or use drugs. It should concern you, however, that most doctors are unaware which of their patients fall into these categories. People with substance use disorders or substance use are often unaware themselves of what risk they're at for addiction, disease, injuries, death, and then there are the great costs these outcomes pose to our healthcare system. The fact that most Americans have never discussed substance use with their doctor is a huge missed opportunity, because we know that when clinicians do facilitate a brief conversation, especially using a skill called motivational interviewing, patients with, for example, risky alcohol use have been shown to reduce their consumption up to 34% in a year. Now that kind of reduction can make the difference between preventing someone from dying in a car accident in the short term or from a stroke in the long term. And then there are Americans living with addiction. For these folks, doctors are in the unique position to identify possible substance use disorders and help these patients access treatment, which, as you can see, is dramatically underutilized in this country. So knowing this, government organizations, nonprofit organizations together have spent a lot of money in the last couple of decades trying to fund efforts to convince doctors to screen all their patients for substance use and respond appropriately. However, as of today, most doctors do not. So why? Well, I can tell someone who has trained doctors in the last 8 years on the subject that they are not necessarily to blame. They want to help their patients, but they're often confounded by the realities of a busy clinic and what it really means to adequately assess every patient's substance use. Consider this workflow, for example. For clinics brave enough to screen for substance use, they often rely on this multi-step, paper-based process where adult patients get a questionnaire in the waiting room. If they're positive, they get 1 and/or 2 longer questionnaires in the exam room. Patients who are pregnant or who are adolescents get their own specific screening questionnaires. And then all this data needs to be entered by hand into the electronic health record. So as you can imagine, this creates some barriers. The 3 biggest barriers are: 1, patients are asked unnecessary or insufficient questions. 2, patients with low literacy or language barriers are often unintentionally excluded. And 3, we are adding to the already high burden of documentation in the EHR. So in response, OHSU Family Medicine partnered with AltSource to create a solution. This free web-based application revolutionizes how we screen for substance use. It resolves all those 3 barriers. To begin with, we want to make sure patients are asked the right screening question. So we started by creating what we believe is the ideal flowchart of substance use screening tools. Now on paper, this will require patients to follow skip patterns that are far too complex. But using our application, only 1 question is displayed at a time. Only questions that directly relate to what the patient answered previously are displayed. So this means patients with low risk use, for example, are quickly screened in less than a minute. Patients with more complicated use can be thoroughly assessed in less than 5. When it comes to literacy and language barriers, we know in healthcare that all information we give to patients should be at an 8th grade reading level or less. Tricky when we need to use multiple 3-syllable words in screening tools. The solution is to simply read the questions out loud. Patients tap the audio icon on the upper right. The question and answer choices are read aloud in their chosen language, and they avoid the embarrassment of asking for help, and they're much more likely to complete all the questions. Perhaps the biggest game-changing feature of our app is its ability to convert patient answers into progress notes. Documentation is a huge burden. Physicians spend on average 2 hours or more each day just writing notes. But our application converts all the patient data into a narrative, chart-ready format. All types of substances used, frequency of use, associated consequences, what response is indicated from the clinician, all written for you. So when clinics create our app, immediately their workflow is streamlined. Patients receive a tablet in the waiting room, their answers go straight to the EHR, and the results automatically appear in front of the clinician in the exam room. But wait, there's more. Knowing that clinics also screen for depression, we threw in screening tools for depression. And any organization that wants to tailor our application to suit their own needs, we made the source code available for free to download and modify. Our app, located at this web address, has the power to give doctors the luxury to focus less on the burdens of addressing substance use and more on the benefits of helping patients, all in the amount of time it took me to deliver this presentation. Thank you.
Fantastic, thank you. Jim?